On the right side, we tilt the probe to the right side, and we will see now the transverse processes of the vertebral bodies. I'm going back. These are the vertebral bodies, the other vertebral body, and this is the intervertebral disc. There. This is intervertebral disc. This is the body. Keeping this body in focus, I'm moving lateral, and there you see. This is a transverse process. Going back in the midline are the vertebral body. I'm focusing this vertebral body and moving the probe laterally, and I will see a transverse process producing black shadow. This is one. This is the other one. This is the next one. So you can see 1, 2, and 3. So when we see these transverse processes, behind the transverse processes, here, this tubular structure is the vertebral artery, but it will be visible only in between the two shadows. Shadow of this transverse process and this transverse process. Maybe you can appreciate its pulsation. There we are. Just to tell you and to show you where is my carotid, I tilt medially. There you are. The carotid, the prevertebral muscles, the vertebral bodies, the intervertebral disc. This is the carotid. This is the vertebral disc. This is the vertebral body, the prevertebral muscles. And now I'm going lateral. I'm leaving the common carotid and I'm going for the transverse process. And as I see the transverse, I see the vertebral artery. Now, I'm going to put color here. It is blue because the blood is going down. It is going down. It is blue. I can change the color if I feel like. And now I'm going to apply the Doppler, the pulse wave. There we are. So, my dear, just to check the systolic diastolic ratio, we will see this is peak systolic and diastolic here. So 16.9 divided by 7.3. So almost you can say 2.2 to 1 or maybe 2.1 to 1. So it is similar to the one which we find earlier we found for the internal carotid artery. So remember that we will always find the systolic diastolic ratio of internal carotid artery and the vertebral arteries alike. The two vessels on the right and two on the left, all four are going to supply the brain, a vital organ. And therefore, this should be the ratio. More flow should be there in the diastolic phase compared to the systolic peak, which is the other way when we consider non-vital organs like muscles and skin, like we see in external carotid artery. So therefore, we'll find the systolic diastolic ratio of vertebral artery similar to that of the internal carotid. Going back, the carotid, the prevertebral muscles, the vertebral bodies, intervertebral disc, the body, concave anteriorly, and now we are going laterally, and there you see the vessel and the transverse processes. There we are. This is it. The vertebral. This vertebral artery, if in a thick-necked individual, is difficult to see in this longitudinal section which I have shown to you, then it is always good to place the probe in cross section like this. And you will see like this. You will see the carotid beating there, and the vertebral body, and on the side here is the vertebral artery and vein, the carotid above, the vertebral below. Mostly in elderly, it is difficult for us to see such a nice vertebral artery as you are looking upon here. And we just have to determine the normal pattern of flow. And in those individuals, if linear probe is not helpful because of its less penetrating power, then we will be using the convex probe. Indeed, the resolution will be of not that good quality, as we have seen with the linear. But the flow will be visible to us. The common carotid, the vertebral. So, in elderly or thick necked individuals, we will use convex. Going back to the linear now, we can see here from this supraclavicular region or below the clavicle, the subclavian vessels. There we are. We will go to the suprasternal notch and can see the branches coming from the arch of aorta and similarly from this side we will see the left subclavian. It is always important for us to see the left supraclavicular region. इधर देखें मेरी तरफ. For any lymph nodes or so. So we have seen, ऊपर देखें, the left-sided vessels, and definitely अब सीधा देखें, there are bigger lymph nodes here. Above the carotid, you can appreciate the flow inside. There you see. Okay.